Hi students, I am Dr. Ramakrishna Chaitanya, your Anaesthesia faculty. So today in this session, I am going to discuss the recent November 2023 INI-CET question paper of the anesthesia related questions. So I know you are preparing very hard for the upcoming INI-CET examination. So just to brush up the important things, what have been asked in the previous year. So we thought we'll put up the last year MCQs and make a small video session. So without wasting much of your time, shall we enter and see the questions? So one point I want to make it clear, like there are so many questions have been asked, but purely anesthesia related questions, there are only 2 questions. I don't want to add all the questions and take the credit like, this is from anesthesia. This no, because I don't want to, at this last hour of your examination, I don't want to stuff the things into your brain so that it will be difficult for you. And I don't want repetition because some of the questions, they can be, they are discussed by the surgery faculty. Some of the questions, they are discussed by the pediatrics faculty, etc. So what I wanted to do in this session, I don't want to waste much of your time. I want only short amount of time, and I want to limit myself exclusively to anesthesia related question so that there is no repetition of the topic. Okay, so rather than telling all the things which again going to be repeated by the other faculty, it doesn't look good. So exclusively anesthesia related questions I would like to tell you, and at the end I will tell you what are the key areas when you are preparing for the upcoming INI-CET examination where you need to study or where you need to revise the things. Okay, so without wasting much time, shall we enter and see the question? So what is the first question that has been asked? A 5-year-old is on 3-liter oxygen via nasal cannula. What is the appropriate FiO2 level for this child? Now, this is again a straightforward question which we have discussed many times in our video lectures. So, oxygen delivery devices. So, we all know that oxygen delivery devices are classified into 2 categories. One is oxygen delivery devices are classified into 2 categories. One is high flow fixed performance devices. Fixed performance devices. The second one is low flow variable performance devices. Variable performance devices. So we have been discussing this topic many times because since so many years, 2020, every year they are asking one question on the oxygen therapy. And in our regular video modules, we have made a small lecture. I have given a small lecture of around 30 to 45 minutes of lecture on oxygen delivery devices, how to choose the oxygen delivery devices. So just recapitulating what we have discussed. So high flow fixed performance devices, the classic example is Venturi mask. Venturi mask. So where do we use this Venturi mask? We generally prefer to use it in COPD patients because it delivers fixed amount of oxygen to the patient, so that whatever the carbon dioxide drive that is there in the patient will not be washed away with that oxygen. Okay, so for fixed performance devices, the classic example is Venturi mask. We use it in COPD patients. Now coming to very favorite question for the examiners, 2020 it has been asked, 2022 it has been asked, and recent 2023 also they have asked low flow variable performance devices. The example of low flow variable performance devices are nasal prongs. So what nasal prongs? You might be seeing this nasal prongs, like, so we use it very commonly in our patients. So what is the flow rate we use? The flow rate with which we use nasal prongs is 1 to 6 liters per minute. And very, very important point about nasal prongs is with each 1 liter of oxygen, it increases FiO2 by 4%. Right? So what was the question that was asked? The child was receiving 3 liters, right? So with 3 liters, how much is the FiO2? So 3 into 4, it comes to around 12. 3 into 4, it comes to around 12, right? Now, for this 12, you are also getting atmospheric oxygen, right? Which comes to around 21%. So what should be the correct answer? 21 plus 12. So if you go on to maths, 31, 32, 33. So somewhere between 33 to 34% is the right answer for your entrance examination, right? So let us finish off the topic, then go back to the answer, right? So the nasal prongs is the classic example of low flow variable performance devices. The classic example is nasal prongs, which we can provide 1 to 6 liters per minute of oxygen. and for each liter it will increase the FiO2 by 4%. So if you put for 6 liters, the maximum amount of oxygen that you can be delivered to this patient will be around 44%, 44 to 45%. So this is a very standard question. 2 times it has been asked about the nasal prongs. Now coming to the next low flow variable performance devices. The other one is simple oxygen mask, which you might have used many times during your casualty postings or internship postings, right? So simple oxygen mask, the flow rate should be around 6 to 10 liters per minute. 6 to 10 liters per minute, and somewhere between 60 to 65% is the FiO2 increase. It increases FiO2 by 60 to 65%. Now coming to the third one, very important question. Again, this has been asked 2 times in your entrance examination. That is non-rebreathing mask. You might have seen it would look like a simple oxygen mask only. The only extra attachment will be a reservoir bag will be there. So it is a simple oxygen mask, simple mask with reservoir bag. With a reservoir bag. The flow rate should be around 10 to 15 liters per minute, and it increases FiO2 by 80 to 85%. Some books even say 90% also, but let us go by this. Maximum increase in FiO2 is seen with non-rebreathing mask. So in COVID period, we have used a lot of non-rebreathing mask in our patients to improve the oxygenation of the patients. Okay, so these are called as low flow variable performance devices. So fixed performance devices, the classic example is Venturi mask, and we use it Venturi mask most commonly in COPD patients because it delivers fixed amount of oxygen to the patient. Now go back to the question and see what was the question that was asked. So 3 liters of nasal flow that is there. So what is the appropriate answer? So somewhere between, we are not very sure of the options, but somewhere the good option will be 3 into 4 is 12, 12 plus 21, that is 21 plus 12, 31, 32, 33, 34. So somewhere between 30 is the right answer. So I don't think they have given any closer option like 33, 34, 35. No sane person will give you. So if they all they give you this option, so don't forget. The only take home point I wanted to tell you is because many students have, they remember this word, 1 liter of nasal prongs will increase FiO2 by 4%. That everyone will remember. So 4 3 is 12. Everyone remember. So there is no 12. So don't forget that we are also taking that atmospheric oxygen also. The 21% should also be included here. So it comes to around 30 to 34%. So 33, 34 is the correct answer. The most appropriate answer in this given options will be around 30%. Right? So we made a beautiful session on 30 to 45 minutes of session of oxygen therapy. Please go through it. It is a very strong recommendation from my side to listen to the oxygen therapy before attempting to the INI-CET examination. Right? Shall we look at the next MCQ? Right. Which of the following is the best representative of ASA grading classification? Right. Now coming to ASA classification. Again, we have discussed this topic in toto in our video series. I don't want to tell every time that everything came from my videos. It's not from my videos. It is from the textbook which we have taught, what we have discussed, that has only came in the examination. That is what the logic says, right? So whatever we have discussed, that is from the standard textbook only, and that standard textbook only is asked in your entrance examination. Right. So what is this ASA classification? I said you in the class of pre-anesthesia checkup, we take a lengthy history of the pre-anesthesia checkup. We take present history, we evaluate the personal history, we evaluate the family history, we evaluate the allergy history, all the histories we take, we do the physical examination, we do systemic examination. But at the end of the day, there should be a simple way for me to come to a conclusion that how much amount of risk that is associated by giving anesthesia or getting surgery performed on this patient. So for this, we have used a simplified scoring system that is called as ASA scoring system, which is popularly known as American Society of Anesthesiologists grading. So Americans are the best persons to judge the people. So what we have done is we have done this ASA grading system. So what we have done in this ASA grading system is we have graded the patients into 1, 2, 3, 4, 5 and 6. We have divided the patients into ASA grade 1. So ASA grade 1, the classic example is normal healthy patient. What do you mean by normal healthy patient? The patient is having, appropriate BMI, is not overweight or he is not underweight, he is a non-smoker, he doesn't have any comorbid conditions, he is like, occasional alcoholic, non-smoker, appropriate body weight, non-smoker, no comorbid conditions, no comorbids. So this is a classic example of ASA grade 1. ASA grade 2, mild systemic disease without functional limitation, right? So what are the examples of it? The current smoker, he belongs to ASA grade 2 only, who is having mild to moderate obesity, because obesity is a very big problem. Of late we are not seeing underweight patients, but mild to moderate obesity, they belong to ASA grade 2, and he is having some disease like asthma, hypertension, bronchial asthma, hypertension, diabetes, everything is under control. It is under control. So they belong to ASA grade 2. Even you can include pregnancy, because in pregnancy there are a lot of changes. Pregnancy means you don't take like 7th month, 8th month, like early stages of pregnancy, definitely without any comorbid conditions, you can always put pregnant lady. Because of lot of physiological changes, we put pregnancy under ASA grade 2 category, right? Now coming to ASA grade 3, which was asked in your entrance examination, a severe systemic disease with functional limitation, So what are the examples of ASA grade 3? Morbid obese patient who is having disease, for example, chronic liver disease, chronic kidney disease. With this liver disease, the patient cannot do his day-to-day activities. For example, if you take chronic liver disease patient, he will have pedal edema, he will have ascites, so he cannot climb 2 flights of stairs. Or if a patient is a chronic kidney disease patient, every third day or second day he has to go to dialysis and he has to get dialysis done, right? So this is the disease that is impairing. The disease is severe disease, but it is impairing the functional activity, so they belong to severe systemic disease. Also you can include COPD patients also, so these are all the categories of ASA grade 3, right? Coming to grade 4, what are the examples of grade 4? It is a severe disease with his threat to life. For example, unstable angina or recent MI, or recent CVA. These are all the examples of severe disease which is threat to patient. Now coming to ASA grade 5. The grade 5 example is moribund patient. Moribund patient. If you want to see a moribund patient, whenever there is a mass casualty incident at your area or locality, you will see this. The patient will be having head injury, upper limb injury, thoracic injury, all sorts of injuries will be there. And this patient, whether you operate or not, they are not going to survive. Operate or not, no survival. Okay, so these are moribund patient. Now coming to grade 6. What are the examples of grade 6 patient? The grade 6 patient is classically brain dead patient. So we discussed it in detail. I have given one example also. If you want to remember ASA grading, you just remember you are a group of 5 friends and you planned a short trip somewhere to Goa, somewhere to Manali, or somewhere, any other place. Now you are grade 1 patient. You doesn't have any comorbid condition. You are non-smoker. You are having normal BMI. So definitely you can go for the trip. ASA grade 2 means one of your friend is a known case of, he's a smoker, mild to moderate obese. He's having hypertension, but it is under control. Diabetes, under control. So these are all the patients, they will put it under ASA grade 2. So third friend of yours is having systemic disease like CLD, CKD. You planned a Goa trip for 3 to 4 days. He cannot accompany with you. So this is called as functional limitation. Severe disease with functional limitation. Grade 4, your friend has got recent MI or unstable angina. Don't push him to your triple, but rather than him, we admit the patient or we ask the patient to take rest. So grade 4. Grade 5 is a moribund patient. As I given you example, whenever there is a mass casualty incident, you will definitely see moribund patients. Then grade 6 is brain dead patient. So for your examination, most commonly examiners will ask between grade 2 and grade 3, because that is where slightly confusion will come. That is the reason why I have given this analogy in the video series, that how to differentiate between grade 2 and grade 3. Very simple, whether you can take him to your favorite trip or not, somewhere in the place what you are thinking. If you can take him, he belongs to grade 2. If you can't take him, he belongs to grade 3. So let us look at the options. So what is the correct answer? Mild disease. Mild disease under control, he belongs to ASA grade 2, right? So I am not interested in grade 2. So what is this? They have asked grade 3. Moderate disease, they have said, okay. Moderate disease, rather than moderate disease, the good word is a severe systemic disease, which is having functional limitation. So this one would be a good appropriate answer. We I'm not very sure, because some students are given some other options also. But if you ask me, because in the ASA grading system, it has given very clearly grade 3 means severe systemic disease, which is having functional limitation. So as per anesthesia is concerned, only 2 questions have been asked in your entrance examination. But remember, there are 2 or 3 questions which have been asked, but they are not directly from anesthesia. They have been picked up somewhere from your surgery or pediatrics. So those faculties will be discussing. I don't want to waste your time, so I am concising my subject only to 2 questions. But very important take home point I wanted to give to you is, in your INI-CET examination of late, the trend of asking the questions, if you are preparing for the INI-CET examination, make sure you prepare these topics mandatorily. What are those topics? The first one is pre-operative preparation. In our video module, it's not pre-operative evaluation, it's pre-operative preparation. Preparation means, I said you, investigations, consent, risk stratification, and how to optimize pre-medication. All these things, they come under pre-operative preparation, because of late in your examination they are asking more about the risk stratification only. If you look at the last few years of examination papers, they have been asking about which patient is high risk for post-operative pulmonary complications, which patients are high risk for post-operative cardiac events. Now, this year also they have asked about ASA system of classification. The second question, which is very favorite for the examiners, is the oxygen delivery devices. Just now we discussed it very briefly. So please go through it, oxygen delivery devices. The third area, if you look at the previous MCQs here, every year they are trying to ask 1 or 2 questions regarding the ventilator management. Ventilator management. Right? So ventilator management also, we made a separate module of around 3 to 4 lectures I have given, like how to optimize the patient on ventilator, what are the things you have to look at it. Please go through the basics of the ventilator module, because every year they are asking one clinical scenario for a patient who is on mechanical ventilator, and what is the next step or what should be done to improvise the patient status, something like this. And fourth important area, what I feel, is base BLS and ACLS. Sometimes examiner might be very much interested that these are basic rhythms which every student should learn: basic life support and advanced cardiac life support. And the last but not the least one is the pharmacology, anesthetic pharmacology, because in the last few years no direct question in the pharmacology has been asked. So there is a high probability, because the local anesthetics, whether you take local anesthetics, muscle relaxants or inhalational agent, they might put up some clinical scenario and they will try to ask something which is related to pharmacology. So if you ask me what are the important areas, I will categorize this. If it's always better to completely revise anesthesia. It will not take much time, because the weightage is around 3 to 4 questions they will ask every year. So from other subjects also, if you having a time, please revise it very quickly. Or if you want to review the important topics, don't forget to review these important topics. This is very, very important for your upcoming examination. So with this, I concluded this very small session where I have discussed only anesthesia related MCQs. Wishing you all the very best for your future. Thank you.